Congratulations on considering bariatric weight loss surgery. You've taken the first step towards a healthier and fuller life. This video will explain everything you need to know.
Hello, my name is Dr. Bernard Benedetto. I am board certified in general surgery with fellowship training in minimally invasive and bariatric surgery. I completed my bariatric surgery fellowship in New York in 2008. After that, I joined the Massachusetts General Hospital Department of Surgery, and I served as the medical director of the bariatric surgery program at North Shore Medical Center. Over the last 10 years, I have performed more than 2,000 advanced laparoscopic surgeries. I'm thrilled at the opportunity to bring my skills and experience to Atlantic Surgical Associates and the amazing bariatric surgery program here at Portsmouth Regional Hospital.
Hello, my name is Jessica LaFleur and I'm a registered dietitian and the program director for the New Hampshire Medical and Surgical Weight Loss Program. I graduated from the University of New Hampshire in 2003 with a bachelor's degree in nutrition sciences. I then completed a dietetic internship in 2004 at Keene State College. I have been working with weight loss surgery patients since 2004 and have been working at Portsmouth Regional Hospital since 2011. It is extremely rewarding seeing the success of patients after they have embarked upon this life-changing procedure. When I see the smile on their faces as they share their story and tell us that they got their life back, it is an instant source of gratification that our entire team was part of their journey and helped to provide them with support and encouragement along the way.
We're here to help you through this process, educate you, and help you make an informed decision. Watch this seminar in a quiet area. Have a pen and paper ready to jot down any questions or notes. After you have watched the seminar, you'll receive a call from one of our staff members to discuss your first consultation, and you may ask them any questions you have at that time.
We will be discussing the background on the obesity epidemic and the rationale of weight loss surgery. We will outline the different types of weight loss procedures offered at Portsmouth Regional Hospital, and of course, the overall health benefits of undergoing weight loss surgery. Over the last 20 years, the percentage of Americans who are obese has dramatically increased. It is the most chronic health problem and the second leading cause of preventable death. More than 50% of adults are overweight, about a third of both adults and children are obese, and greater than 5% are considered morbidly obese. Obesity is actually a disease in and of itself and causes dysfunction in multiple body organ systems. The good news is that for individuals failing conservative treatment of obesity, surgical treatment is available, extremely effective, and sometimes the only available cure of certain obesity-related medical conditions.
So what are the risks of being obese? Obesity can lead to many dangerous health conditions, including diabetes, asthma, hypertension, arthritis and joint pain, stress incontinence, migraines, depression, and fertility problems. It is anticipated that the next generation will not live as long as the current generation if things continue the way they are. If your weight is more than twice your ideal body weight, your risk of early death is doubled compared to someone who is not obese. Bariatric surgery can change this.
When combined with a comprehensive treatment plan, bariatric surgery can act as an effective tool to provide you with a long-term weight loss and help you increase your quality of health. Bariatric surgery has been shown to help improve or resolve obesity-related conditions such as type 2 diabetes, high blood pressure, heart disease, and more. Significant weight loss through bariatric surgery may also pave the way for many other exciting opportunities for you, your family, and most importantly, your health.
This is the first 3 digits of your 9-digit patient code number that you'll need to have available for pre-qualification for your first consult after viewing this seminar. The next 6 digits will be displayed throughout this seminar.
Now let's discuss how we define obesity. The BMI, or body mass index, is a ratio of weight over height and is a more accurate predictor of the class of obesity than just weight alone. The normal body mass index range is between 19 and 25. An individual is considered overweight if their BMI is up to 29. Class 1 obesity is defined if the BMI is between 30 and 35. Class 2 is between 35 and 40, and Class 3, or severe obesity, is when the BMI exceeds 40. You can easily calculate your body mass index with a chart like this. Just find a number where your height and weight intersect. You might be a candidate for weight loss surgery if your current BMI is greater than 40 without any medical conditions, or a BMI of 35 with at least one major comorbidity like hypertension, diabetes, sleep apnea, or other medical problems. How do these surgeries help you lose weight? Weight loss surgery will help you lose weight in two possible ways: restriction and malabsorption. Restrictive surgery restricts the amount of food that you can comfortably eat so you can take in fewer calories. Malabsorption not only restricts your body's calorie intake but also limits your body's ability to absorb nutrients and calories.
Bariatric surgery, such as gastric bypass and sleeve gastrectomy, work by changing the anatomy of your gastrointestinal tract and by causing different physiologic changes in your body that change your energy balance and fat metabolism. Regardless of which bariatric surgery procedure we decide is best for you, it is important to remember that bariatric surgery is a tool. Weight loss success depends on many other important factors such as nutrition, exercise, behavior modification, and more. By changing your gastrointestinal anatomy, certain bariatric procedures affect the production of intestinal hormones in a way that reduces hunger and appetite and increases your feeling of fullness. The end result is a reduction in the desire to eat and in the frequency of eating. Interestingly, these surgically induced changes in hormones are opposite to those produced by dietary weight loss alone.
This is the second set of your 9-digit patient code number that you'll need to have available for pre-qualification for your first consult after viewing this seminar. The next 3 digits will be displayed at the end of this seminar. Let's take a moment to pause and hear about one of our own patient testimonials and her journey to a healthier lifestyle.
My name is Jessica Davis. I'm 31 years old and I've had gastric bypass surgery. Prior to having gastric bypass surgery, life was very lonely. I wasn't able to do a lot of the normal activities that normally people can do. Sit in booths at restaurants were difficult. I couldn't go on an airplane. It made it very difficult to visit family and friends. I couldn't work out and I really wasn't able to have a real life. I looked at the direction I wanted my life to go into. I was almost 30 years old. I wanted to get married and have kids and really felt that it wouldn't be fair nor possible at almost 400 pounds to do those things, to have children, to get married. And I really wanted those things, and I knew that if I really wanted to have those things in my life, then I was gonna have to work at it, and that no matter how you're losing weight, whether it be gastric bypass or any type of surgery or any type of program, it was gonna be difficult. But I knew that by sticking to it, by following everything that was asked, all the appointments, going to those and going to all the support groups and really trying hard to lose the weight that was required was going to get me to where I needed to be in order to have the surgery and lose weight and have a better life. I decided to go with this program because I had known somebody who had used this program prior and they had had success. I did research other programs, but really thought that this was the best program for me. I liked the staff, I liked the setup of the support groups, and had really done my research, and this is what made me decide to go with this program. Since having gastric bypass surgery and losing a lot of weight, my life has changed completely. I've changed jobs, I've gotten a boyfriend, and now I can call my fiance. We're planning a wedding in a year. I just would have never had imagined my life how it is now before. Honestly, it's like a dream come true. Had I not lost this weight, I would feel like I would be essentially dead. And sort of that's what I felt like before I had surgery. And now I feel totally alive and happy and feeling like anything that I can do is achievable. If you're thinking about having weight loss surgery, really think about if this is something that you're ready for. It takes a lot of commitment. You have to be at all your appointments, and really what's most important is making sure that you're ready mentally. You're ready to put in the effort that you need to make your life a priority, make losing weight and getting healthier a priority. If you don't put other things aside and make you a priority, then you won't be. It's really important to make sure that you're focusing all your time on you and getting healthy.
There are 2 primary weight loss procedures: the sleeve gastrectomy and the gastric bypass. Both of these procedures reduce the size of your stomach in order to limit the amount of food that you can comfortably eat in one sitting, therefore restricting your overall caloric intake. The gastric bypass also reroutes the intestine to add malabsorption of ingested nutrients, which can result in quicker weight loss, but also results in some less pleasant side effects. The gastric bypass had long been considered the gold standard in that it combined restrictive and malabsorptive methods in a way that produced great weight loss with relatively few side effects. At Atlantic Surgical Associates in Portsmouth Regional Hospital, we offer both the gastric bypass and the sleeve gastrectomy as primary weight loss procedures, all done laparoscopically in more than 99% of cases. Sleeve gastrectomy has gained popularity because it combines excellent weight loss and comorbidity resolution with a very low complication rate. During the sleeve gastrectomy, the stomach is reduced to about 25% of its original size by removing the part of the stomach that is involved with secreting hormones that impact your hunger and satiety. The result is a sleeve or tube-like structure that restricts the amount of food that a person can eat.
The hospital stay and restrictions for both gastric bypass and sleeve gastrectomy are very similar, with up to a 2-night hospital stay, 3 weeks off work, and a weight limit restriction of 10 pounds for about a month.
The Roux-en-Y gastric bypass significantly improves obesity-related comorbidities, including diabetes, sleep apnea, hypertension, arthritis, hyperlipidemia, and stress incontinence. It is an established method of surgical weight loss and results in restriction of caloric intake with profound early satiety. The long-term weight loss following gastric bypass is easily sustainable. The bypass can often provide almost 70 to 80% of excess weight loss, with 60 to 70% on average. The nutritional risks followed by gastric bypass include vitamin deficiencies are uncommon and easily manageable. The gastric bypass involves creation of a small stomach pouch which is connected to a loop of small bowel. Ingested food does not come into contact with more than 100 centimeters of small intestine, which would normally be absorbing those calories and nutrients.
After having Roux-en-Y gastric bypass surgery, you may expect to stay in the hospital for 1 to 2 nights with a 2 to 3 week recovery.
All patients must take lifelong supplements following weight loss surgery to prevent long-term nutrient and vitamin deficiencies. The number and type of supplementation depends on the procedure performed.
The treatment protocol at New Hampshire Medical and Surgical Weight Loss Center involves several steps. Some of these timelines may be dictated by your individual insurance plan. The process begins with an initial surgical consultation, a mandatory education class, obtaining blood tests, and a dietary consult. Patients then undergo a compliance period and any specialty consultation that may be required prior to obtaining insurance pre-authorization. In the simplest of cases, this process may take up to 2 months prior to scheduling surgery.
Now that you've learned more about our surgical treatment programs, take a moment to hear from another patient who recently underwent gastric bypass surgery.
My name is Ray Delcourt, and I am 49 years old, and I had the gastric bypass completed. My life before surgery, I was heading for disaster. I was overweight, I was heavy, my quality of life was very poor, tired a lot of fatigue, difficult to move around and do everyday chores. So I decided to look into weight loss surgery here at Portsmouth. I found out about the program through an info session in South Berwick, Maine, and went and got some information about the program and knew it was the right one for me. My ultimate goal was to lose the weight, but more importantly to keep it off. One thing is to lose it, but anybody that's heavy knows that it's always a roller coaster. You're always losing and you're always gaining. You're always losing and you're always gaining. I really wanted to keep it off for life, and they keep on talking about a lifestyle change, and it really is a lifestyle change. It took me 49 years to figure that out, but it really is a lifestyle change. You've got to get in the mindset to do what they instruct you to do here. You can lose the weight and keep it off for life, and that really is my end goal, is to keep it off for life. My life has changed so positively since having the surgery. I'm able to move around a lot better, able to do work around the house. I'm a firefighter in town. I'm able to do my job a lot more proficiently. My quality of life has improved greatly since having the surgery, and it's all because of the team here at Portsmouth Hospital. This is a world-class organization, and if you're thinking about weight loss surgery, this is the place you want to have it done. I keep on telling everybody, and I believe this from the bottom of my heart, I was headed for medical disaster prior to surgery. And these folks saved my life. They really did. The team here is wonderful. They want you to succeed. They're committed. They're more committed than you are, and they're not going to let you fail. And I think that's what I like about these folks here at the Weight Loss Center at Portsmouth.
Before, during, and long after your surgery, Dr. Benedetto, as well as the entire staff at New Hampshire Medical and Surgical Weight Loss Center, will provide the support you need for success.
You have already taken your first step by viewing this online seminar. Our staff will contact you about initial consult and evaluation, and training to become an optimal surgical candidate will begin. Thank you very much for viewing, and we hope you join us in this very exciting process.
This is the last set of your 9-digit patient code number that you'll need to have available for pre-qualification for your first consult after viewing this seminar. Please keep this 9-digit number to use for verification of viewing this seminar. If you have questions, please call us. We're here to help. Welcome to the freedom to live the way you always wanted to.